What is a blood drug test, and when is it used? Have you ever wondered how medical professionals determine if someone has recently used drugs? One of the most accurate methods is through a blood drug test. This test is a laboratory procedure that checks for drugs or their byproducts in a person's bloodstream. A trained professional, like a phlebotomist, draws a small amount of blood, usually just a few milliliters, from a vein. The process starts with sterilizing the area and applying a tourniquet to make the vein easier to see. Then, a needle is inserted to collect the blood sample into a vacuum tube for analysis. This method is particularly effective for detecting recent drug use because drugs and their metabolites show up in the blood shortly after consumption. However, the detection window in blood is relatively short, typically lasting only minutes to hours. This is different from urine tests, which can identify drug use over several days. Blood drug tests are often used in situations where immediate information about drug presence is needed. For example, they are commonly utilized in emergency rooms, forensic investigations, and even some workplace settings. Additionally, in substance use disorder treatment programs, blood tests help monitor abstinence and check for relapse. This is essential for ensuring that individuals adhere to their treatment plans. Blood tests can also provide precise measurements of drug concentration, which is especially useful for assessing levels of intoxication, particularly with alcohol. Thanks to advancements in collection methods, such as microsampling with fingerstick devices, blood testing has become less invasive and more accessible. In the context of relapse prevention and aftercare planning, blood drug tests play a vital role. They help clinicians verify that patients remain drug-free and allow for timely intervention if relapse occurs. This monitoring can be critical for maintaining long-term sobriety and adjusting treatment strategies as needed. In summary, a blood drug test is a diagnostic tool that detects recent drug use by analyzing blood samples. It is primarily used when immediate or precise information about drug presence is required, including in medical emergencies, legal cases, workplace testing, and substance abuse treatment monitoring.